It doesn't need an introduction. Congressman Massa, who has become one of the single most important leaders for universal health care in the United States Congress. And we also have, by the way, Lynn Rodberg's daughter, right in the back. You can raise your hand. It's an important little family thing. But what we're going to do is just entertain some questions for this panel, and then the Congressman will introduce the next panel, and then we'll have Q&A after that.
Thank you very much. I wanted to just start off by relaying a small story. I come to you with all of 86 days of seniority in the United States Congress. So much of this is still somewhat new to a freshman member like myself. But we have noticed, and the more experienced members of Congress have discussed with us, the incredible increase in communications coming from the districts to the members, both their district offices and here in Washington. And we've taken to a system of sorting our mail into three categories: ideas and nice stuff. Letters that start off with "help me or I will lose my home," and letters that start off with "help me or I will die." We have had some 35 letters. That's about one every other day, where you open it up. Usually says personal for the congressman, starts off with "as a fellow cancer survivor," or some greeting of that nature. "I just lost my job. I just lost my health insurance. I can't get treatment. I'm going to die unless you help me." You can't sit in this chair as a congressman and receive mail like that and go home at night and act as if nothing's happening. And how it is that our national leadership, and gratefully I think that many of them are now getting it, but how it is that some of my friends and colleagues, often on the other side of the aisle, want to dismiss those letters with trite phrases like phrases like "market forces" or whatever the catchword of the polling group of the day is. How they can do that and still have a shred of humanity at 1 o'clock in the morning when they're trying to go to sleep, I don't know, because I can't. And I've been here for 86 days. 86 days. Folks, if we don't consider this to be the singularly most important task we have before us, then we have not a shred of humanity inside of us. Period. Now, the president came before the Democratic caucus and said, "We will cover all Americans this year." The commitment's on the table. I'm certain of it. The question is, how do we do it? And I'm fighting very vocally, as a member of 86 days of seniority, to ensure that the public option remains whole, intact, and in place. Because when I met with private health insurers, they said, "Eric, you can't have a Medicare for all option. That's not fair. We can't compete. They can do it cheaper and more efficient than we can." To which I said, that's the point. So I'm certain that as we move down this path, as we maintain that on the table, the American public will migrate to the most common sense solution. And that is the most common sense solution. So we're going to talk more about that later, but please know that my commitment to this is absolute. And to those, some in this audience, who have counseled me, this is not the best way to get reelected. That getting out there in this issue and being a lightning rod for this draws fire. I tell them, as I have told everyone, sooner or later, there is a moment when you are a member of Congress wearing this lapel pin, where a decision you take must be more important than getting reelected. It has to be. Period. So, thank you for having me here. Let's open up the floor to questions to our first panel, and then it'll be my honor to introduce the second group of experts who have gathered today. Who would like to be up? Just remember that 86 days of seniority thing.